When I meet a patient for the first time, it's very important for the patient to understand that I own the cancer problem from start to finish, whether I end up operating on that patient or not. I am a head and neck cancer surgeon, which is essentially treating all cancers that are not the brain and not the eye, but above the collarbone. So that includes tongue, lips, throat, skin, thyroid, and anything in the neck. When I was a fellow at Memorial Sloan Kettering, I spent 1.5 years on an NIH-funded grant to do research on head and neck cancer. I think head and neck is quite unique in many ways. It affects your eating, drinking, swallowing, talking, appearance, and all those things all together. In my world, at least, the joys of making it work is finding a way to treat the cancer successfully, at least in my case with surgery, and yet at the same time doing it in a way that lets people still eat, drink, swallow, talk, and go out in public. So you're walking this very fine line between balancing function and balancing curing the cancer. And I think finding that fine line is something that comes with time and experience. And I think that it's something that I do very, very well, because I try to find the balance in all my patients. Something we do great here at FACS is we make sure patients are seen by the entire group of doctors who would all have a potential vested interest in some treatment strategy for that patient. Should these patients be treated with surgery, which is very successful, or with non-surgery, essentially chemo and radiation, which can also be very successful? Working as part of a team is what really gives the patient the best option for treatment. The other part about FACS that I think is wonderful is the amount of ancillary support for everything we do. We have nutritionists, we have social workers, and we have wonderful speech-language pathologists. I think when patients begin their cancer journey, at least under my care, I think it's very important for them to know that I'm available to them to help them throughout the entire journey. And it's important that they have one person that they can stay in contact with, and that person is almost always me. And that's what gets me up in the morning to be there, is because patients need somebody like me to be there for them.